Good day everyone, I am Carljoy M. Tolentino and now I will be discussing my drug literature presentation. So my chosen medicine is RightMed doxycycline from RightMed United Love and its generic name is doxycycline hyclate. Pharmacological properties of doxycycline. Doxycycline is a broad-spectrum antibiotic of the tetracycline class used in the treatment of infection caused by bacteria and certain parasites. Doxycycline or doxycycline monohydrate and the doxycycline hyclate are yellow crystalline powders with a bitter taste. The latter smells faintly of ethanol. A 1% aqueous solution has a pH of 2 to 3 and the specific rotation is 25 to 110 degrees cubic centimeter dmg and 0.01 N ethanolic hydrochloric. Indications of RightMed doxycycline. RightMed doxycycline is a treatment of variety of infections caused by susceptible Rickettsia, chlamydia, and mycoplasma infections including respiratory and genital tract. Like for example, doxycycline can treat pneumonia. Doxycycline has long been used as an effective alternative to B-lactamase antibiotics with proven efficacy in the treatment of both upper and lower respiratory tract infections. Doxycycline are primarily used for the treatment of resumed or proven atypical pneumonia since some physicians are resistant to use it as a monotherapy in community-acquired pneumonia. Since there's a widespread resistance of pneumococci to tetracycline, physicians have been reluctant to rely on doxycycline for monotherapy of community-acquired pneumonia. And also, RightMed doxycycline can treat leptospirosis in children below 8 years old, an alternative drug for the treatment of syphilis, actinomyces, tularemia, shigellosis, and melioidosis, which are caused by different types of bacteria. Contradictions of the RightMed doxycycline. Hypersensitivity. But hypersensitivity reactions to these antibiotics are rare. So for the side effects of the RightMed doxycycline: nausea, vomiting, diarrhea, dry mouth, glossitis, tongue discoloration, stomatitis, dysphagia, esophageal ulceration, oral candidiasis, vulvovaginitis, pruritus, enterocolitis, severe anemia, and hepatotoxicity. So for the interactions of the RightMed doxycycline: reduced absorption with the divalent and trivalent cations, egg al, bismuth, calcium, magnesium, zinc, iron, sodium bicarbonate, cholesterol, and cholinesterase. Nephrotoxicity may be exacerbated by diuretics, methoxycline, and other nephrotoxic drugs. So for the dosage of the RightMed doxycycline. So for the adult, 200 mg as a single dose on first day or 100 mg repeated after 12 hours followed by 100 mg daily. For the children more than 8 years old weighing less than 45 kilos, initially 4 mg per kilogram in 2 divided doses followed by 2 mg per kilogram daily. Patient with sensitive gonococcal infections, 300 mg a single dose or followed by a second similar dose 1 hour later. Patient with syphilis, 200 or 300 mg daily for at least 24 or 10 days respectively. For the patients with acne, 50 mg daily. So for the relapsing fever and loose-borne typhus, 100 mg is a single dose. Prophylaxis of scrub typhus, 200 mg as a single dose. So prophylaxis of leptospirosis, 200 mg once every 7 days should be initiated 1 to 2 days before drug food exposure. So for the administration of RightMed doxycycline, doxycycline is completely absorbed after oral administration. Take with a full glass of water and remain upright for at least 1.5 hours. Take with food or milk if GI irritations occurs. So for some nursing consideration and interventions of RightMed doxycycline. In case of overdosage, doxycycline should be discontinued and symptomatic and supportive treatment should be initiated. Dialysis does not alter serum half-life and thus would not be of benefit in treating cases of overdosage. Monitor signs of pseudomembranous colitis, including diarrhea, abdominal pain, fever, pus or mucus in stools, and other severe or prolonged GI problems, nausea, vomiting, or heartburn. Notify physician or nursing staff immediately of this sign. Monitor signs of hypersensitivity, reactions, or anaphylaxis, including pulmonary symptoms such as tightness in the throat and chest, wheezing, cough, dyspnea, or skin reaction such as rash, angioedema, pruritus, or urticaria. Notify physicians or nursing staff immediately if these reactions occur. Monitor signs of leukopenia, fever, sore throat, signs of infection, thrombocytopenia, bruising, nosebleeds, and bleeding gum, or unusual weakness and fatigue that might be due to anemia or other blood dyscrasia. Report these signs immediately to the physicians or the nursing staff. Monitor and report signs of benign intracranial hypertension, especially in children. Signs include dizziness, headache, tinnitus, nausea, and disturbed vision such as blurry or double vision. Always wash hands thoroughly and disinfect equipments such as wearable, electrotherapeutic devices, treatment tables, and so forth to help prevent the spread of infections. Employ universal precautions or isolation procedures as indicated for a specific patient. Because of the risk of intracranial hypertension, avoid activities that might increase intracranial pressure such as elevating the feet above the head or the Trendelenburg's position. So this is the current research evidence-based practice related to the RightMed doxycycline. So doxycycline for multi-drug resistant gram-negative bacterial infection treatment is coughing review. Introduction. Multi-drug resistance bacterial infections limit available therapeutic options. Doxycycline is an old antibiotic from the tetracycline class that exhibits a wide antibacterial actions including gram-negative bacteria and could be alternative for the treatment of multi-drug resistance enterobacteriaceae. The study aimed to systematically identify, evaluate, and summarize the results of studies related to outcomes of treatment for MDRG and B infections in patients treated with doxycycline. Safety and efficacy review of doxycycline. Introduction. Tetracycline antibiotics were one of the first classes developed following the introduction of penicillin G and the sulfonamides. Doxycycline was developed by Pfizer and is a semi-synthetic derivative of octreocycline. First became available in 1967. It has the advantage over other members of tetracycline family of improved oral absorption and prolonged serum half-life. Doxycycline has activity against a very broad range of gram-positive, gram-negative, and atypical bacteria as well as some protozoa such as malaria. It is also useful for prophylaxis against and treatment of several important potential biological warfare agents. As such, it is widely used in many parts of the world, in particular for sexually transmitted infection, respiratory tract infections, malaria prophylaxis, and for the therapy of some arthropoid-borne rickettsial infections. And that ends my presentation. I am Carl G. M. Tolentino, and this is my drug literature presentation. Thank you.